Okay. Rodenticides can be classified into high toxic. This include phosphide, thallium, and arsenic, and moderate toxic and low toxic as anticoagulant warfarin. In Egypt nowadays, phosphide poisoning is a high and large problem because there is many cases of phosphide poisoning and the mortality rate is very high. Uh, the problem of zinc or aluminum phosphide is due to libration of phosphine gas upon contact with moisture in the stomach. Phosphine is absorbed through GIT or respiratory tract. Phosphine is toxic to lung, brain, kidney, heart, liver, and is a high mortality rate. But the target organ for phosphine gas is the heart. It induces what's called toxic myocarditis, leading to heart failure. These are the picture of different products of zinc phosphide or aluminum phosphide. The mechanism of action of aluminum phosphide may be to failure of cellular respiration, oxidative stress, and depletion of glutathione, but the intact mechanism of phosphide is not known, and so the treatment of zinc phosphide or aluminum phosphide poisoning is mainly supportive because we didn't know the exact mechanism of action of phosphide poisoning or phosphine gas. The clinical picture: the patient will have nausea, vomiting, and diarrhea, and they will have the smell of phosphide because it has a fishy odor. Also, it will induce hypotension and arrhythmia, induce pulmonary edema, acute renal failure, and seizure and coma. But the most affected organ is the heart, and it may induce toxic myocarditis. Toxic myocarditis leading to irreversible shock, and the patient die from cardiogenic shock. Treatment: APC, airway, breathing, circulation, and decontamination with sodium bicarb to reduce stomach acidity and resulting phosphine gas. And we can use vegetable oil. Vegetable oil has a good result because it acts as a protective layer over zinc or aluminum phosphide and inhibit the release of phosphine gas. Also, the patient, uh, if given sodium bicarb, will be improve acidosis and improve the prognosis. So these measures can be done at home or at your site. You can do APC or do contamination with sodium bicarb or vegetable oil, and you can give the patient sodium bicarb. This will improve the prognosis of the patient. After that, in the hospital, fluids are given guided by central venous pressure to keep the CVP at around 12 to 14 centimeter of water. We can give the patient low dose of dopamine, but uh, uh, that after ensuring that the state of the heart allow intake of dopamine because of there is toxic myocarditis and the weakness of muscles of the heart. We don't advise taking of dopamine because it will increase the cardiac load. Also, hydrocortisone can be given to check, but as I told you, the mortality rate of aluminum and zinc phosphide, especially aluminum phosphide, is very high. The last point in our lecture today is about warfarin. Warfarin is an anticoagulant. It's mild rodenticide and inhibit vitamin K cycle, so prevent normal blood coagulation. Simple injection have low threat. Multiple injection produce coagulopathy. The treatment of the patient is guided by prothrombin time. Prothrombin time and the concentration will be affected by exposure to warfarin. So all patients, we do reassure the patient especially if taken it for one time. APC, airway, breathing, circulation, decontamination in the early stages, and we can give vitamin K as antidote, especially if prothrombic concentration is affected. It is if it is less than 75%, we can do so. If the prothrombin concentration between 75 and 100, we can do nothing except APC. If it's decreased below 75, we can give vitamin K. But if it's severely affected, that's below 50%, we can go do a coagulation factor or plasma to the patient to improve coagulation of that patient, because the problem here, as I told you, is type of coagulopathy. This picture in the developed and Western countries, this nice, very nice girl carry the picture to tell them I am not a science experiment to limit the use of different insecticide and newly pesticides which has hazard to the human health. These are my MCQ for you. Please revise this question and work each others to solve this question. You can revise to the lecture again. You can go to the book. You can tell me again. And this is this is my mobile phone. This is mobile phone, and this is email. This mobile phone has WhatsApp in it. So don't hesitate to communicate me. And thank you for your attendance and audience. Thank you.